So good evening to one and all present here. I am Anirban Mitra representing Center Pharmaceuticals. Before we start, I just hope that everyone with their respective families are safe and sound, and I'm sure we will surpass these hard times together like we always do. Once again, welcoming all present here for this wonderful initiative to share knowledge. We welcome here our most valuable medical fraternity present with us today for our program, and we thank you to show your gracious presence. This program is one of its kind, coming from IPS Pune branch, one of the leading academic fraternity of and definitely we will see more such events in our near future. With this not taking much time, I will let me have the privilege to introduce our coordinator for the program, Dr. Dhananjay Ashurkar sir and Jyoti Shetty madam. Uh, one or two lines I cannot confine with the introduction of our coordinators. Dhananjay sir is the former secretary of Pune Psychiatry Association in 2015. Sir has done MBBS and DPM and FIPH from KEM and SGS Medical College. Sir was lecturer at DY Patil Medical College from 2003 to 2007. And one interesting aspects about Sir is he has been elected as the icon of Pimpri Chinchwad area by Lokmat Media Group. That is the icon. So in one word, I will say Sir is the icon. So now next, I will introduce Dr. Jyoti Shetty Madam. Madam is professor and head of the department of psychiatry, Bharati Vidyapith, University Medical College and Bharati Hospital and Research Center, Pune. Madam is member of Institutional Ethics Committee and Medical Educational Unit of the Bharati Vidyapith University. Madam was a convener of Child Psychiatry Subcommittee as well as Forensic Psychiatry and Law subspecialty of IPS. Madam was president of IPS Pune branch from 2016 to 2017 and having 21 publications to her credit. With all this vast experience, in one word, I will describe Jyoti Madam as dynamic. So I am giving to the iconic personality and the dynamic personality to coordinate this program. Over to Jyoti Shetty Madam.
Good evening, everyone. And thank you, Anirban, and thank you, Centaur. And as an initiative of the IPS Pune branch and the PPA, this will be a series of programs that we have planned. Dr. Luktuke being one of our most senior, most psychiatrists of the city, obviously is actually batting first, so to speak. And along with that, I would also like to welcome everyone with a happy new year. I hope everyone has been safe and sound, and we can only wish that this coming year will also be something that will see us go through with the vaccines to a better future. So, without much ado, I would like to introduce Dr. Madhumita Bahale, who would be actually introducing the speaker. So, if Dr. Madhumita I have known since a long time. We are both alumni of BJ Medical College. She's done her DPM from the Sassoon Hospital, MIMH and Department of Psychiatry's BJ Medical College. She has been in the state health services for a long time, about 33 years. She has also been at the regional mental health center in Yerwada. Apart from that, she has also undertaken education counseling as well as published two information booklets and shot a video under the DMHP, Mansamat for COVID patients and healthcare workers, formulated materials and trained the trainers and medical officers in the state to implement the ambitious Prerna project that is aimed at restoring mental health and reducing suicide by farmers, trained and implemented the Manosharya Stereo program of the Directorate of Health Services for counseling people affected in disastrous floods in Kolhapur and Sangli districts of Maharashtra last year. She's also conducted various programs, mental health awareness and stress management programs at various places, including Institute of National Integration of Armed Forces. And apart from that, I think she has been at the forefront, a very senior psychiatrist in our society. Apart from the education and counseling work, she's an extremely good team member. I have worked with her in organizing committee in our conferences, and she's always been at the forefront as a coordinator, as a compare. So I will hand over to Dr. Madhumita to carry the proceeding.
Yeah. Thank you, Jyoti, for those kind words. Good evening, everybody. On behalf of the office bearers of the IPS Pune branch and the Pune Psychiatric Association, I extend a very warm welcome and wish you all a very, very happy, healthy, and prosperous New Year 2021. We all need to be extra grateful to the Almighty for keeping us safe and healthy in this uncertainty of the last year. But we have to leave those anxieties and fear behind and step into this new year with new vigor, new energy, new perspective, and start the new normalcy, which we have to embrace now. So, COVID times have been definitely very, very tiring to one and all, physically, mentally, financially, and emotionally. But we as healthcare professionals have to go further. We have to further serve the community to protect and enhance their total health. And therefore, while doing this, we also need to give ourselves some lighter moments, lighter but definitely liberally enriching also, some diversions, so that we become more charged and we can serve the community better. So the IPS Pune branch and the Pune Psychiatric Association, we have decided to organize talks of masters who stand tall in the field of psychiatry. These talks will be organized on the first Fridays of every month, and these are known as the Pearls of Wisdom, where you will get to hear from great masters in our field of psychiatry or psychology. And these talks are not going to be immensely academic, but nonetheless, they are going to be exceptionally enriching to us and will definitely help us to implement all that we have learned in our practice. So these Fridays talks are going to be fantastic ones, that I can assure. And I hope that all of you will keep joining us for these fantastic Fridays fundas every month. So today we are here to hear and witness, enjoy and experience one of the first pearls of the series. I have great pleasure in introducing Dr. Ulhas Luktuke sir, the senior most psychiatrist of the city of Pune. I have known Dr. Ulhas Luktuke sir many years now. So he has initially worked in the regional mental hospital, but then decided to move into private with the aspiration to reach a wider community. And he has served as a private psychiatrist at the Dinanath Mangeshkar Hospital and the Sanjeevan Hospital. He is a faculty on stress management at the Pune University at Yashida and the National Water Academy. He is the founder of Prajit, a self-help group, and it is running very successfully since the last 22 years. He had established a Phoenix self-help group for marriage guidance. He carried out Manmukh, a program for student and youth development, for 3 years. He has received fellowship of International Council of Sex Education and Parenthood from USA, and also received a Best Book Award from the Maharashtra Psychological Association for his book, Mana Karare Prasanna. For the last 10 years, Sir has been teaching on Santar Ramdas to the Prajit group. His interest, other than psychiatry, are reading and reciting Urdu poetry. As a first lecture, we were thinking, and the first name that struck to all of us, that if we are doing a series of pearls of wisdom, the first gem of in the field of psychiatry psychology, The name is none other than Sir Sigmund Freud. We know Sigmund Freud as a very influential thinker of the 19th and the 20th century. He has given a vast contribution, an immense contribution to the field of psychiatry, psychology, which has later shaped our therapies and modes of perhaps treatment. We have studied Freud in a very limited way. We know Freud has been understood very little, I think, by people. For some, he is immensely loved by some, very much followed by some, but at the same time, almost defied and despised by some. But whatever, we can never neglect an personality like Sigmund Freud. We have studied the psychosexual stages of development, the ego, superego, all his theories, his interpretation of dreams, his words, which he brought into his theories, are not almost used into common vocabulary now. Words like libido, repression, catharsis, and the Freudian sleep, etc. We have studied about his defense mechanisms. But what we as psychiatrists have done is to use the theories of Freud only to treat our patients. But was Freud limited only to these things? Definitely not. Freud has spoken a lot about normal psyche, about normal sex. He has given us the concept of eros, but he has also spoken on normal sex, what are the normal psychodynamics that come into play when we talk of sex. And I thought we all thought that we need to know this. With many people coming forth with sexual dysfunctions and disorders, it is time now to know what normal sex means and what Freud meant by normal sex, what are the parameters that he wanted to explain. And I'm very happy that Dr. Ulhas Luktuke sir accepted our invitation, because to speak on a master like Freud, we have a master like Dr. Ulhas Luktuke, who has been speaking on Freud, taking regular lectures on Freud since many years now. And we are very, very happy, sir. I thank you once again. And I'm sure all of us are going to get a very, very new perspective about Freud's teachings, about his theories today. And we will be very happy if it's going to, if you will pose some questions, because Dr. Luktuke sir will be more than happy to answer all your queries. So saying that Freud had said that love and work are the cornerstones of our humanness. With this, I request Dr. Ulhas Luktuke sir to kindly start his elaboration, Sex as Freud saw it. Thank you.
Thank you very much. Before I begin, just give me 1 minute adjusting my chair. Just 1 minute. Yes, I am now fine. Madhumita, do I start?
Sir, please.
Please, yes. My dear friends, let's start. January 1, 2021, Friday. Indian Psychiatric Society, Pune branch, Pune Psychiatrists Association, Zoom online meeting, 9 p.m. to 10:35 p.m. Friday Pearls webinar topic. Sex as Freud saw it. Speaker, Dr. Ulhas Luktuke. I am Luktuke speaking. Leader line for today's speech will be: sex is that which decides, determines, differentiates, and designates. These 4 Ds we'll see in the course of my speech to you, I'll describe these 4, plus there are 6 more. There are 10 Ds which tell us how Freud looked at sex. Chalo. Freud looked at it very differently. He saw it in terms of energy dynamics. There are many misunderstandings about Freud. One of them is Freud spoke only about peno-vaginal sex, which is not so. For Freud, sex is love, union, and life. And that's what we are going to see in our lecture, how Freud looked at it. He looked at sex in terms of energy dynamics. In the formation of personality of Freud himself, there were many influences. For example, he was profusely influenced by developments in physics that time. Consequently, he felt that the energy and the matter, they are related to each other, and for the movement of the matter is the energy which is necessary. So he looked at life in terms of energy dynamics. And we are going to look at our topic today in terms of energy dynamics. That's the difference we are going to see. Okay. How do we describe Freud himself? Okay, he was a psychiatrist, he was a psychologist and a neurologist and whatnot. But besides that, a physicist, a biologist. His theory is psycho, bio, social, and mental. Please realize Freud differentiates between the term psycho and the mental. That will come to a little later. So psychosocial biological theory is what Freud is known for. Then he was a determinist. He would go to the point. He would say, I want to go to the root of the problem. There must be some rules with which whatever has happened, let me see that. And then if there is a way out, there must be some rules to follow it. In this way, Freud was a determinist. And then he was an analyst that we know. After the analysis, he would give synthesis to the patient or the client. So he was a synthesist also and therapist that we know. Okay, that about basic idea that I have in my mind. We would like to look at sex in terms of energy dynamics. We'll see that. Okay, now let's come to point 1. Psychosexual genesis of personality. There is a reason why I'm going into that. Because, as I told you, Freud talks about psychosexual, not metrosexual. He is keen on using the term psych. He is keen on looking into the life aspect of it. So, psychosexual genesis, not development only, genesis of personality. So, 1.1, personality. Character represented as on stage. Here is a pitfall. When we talk of personality, when we teach to our students, we say personality means persona, a mask, and we all behave with a mask around. Wait. In a drama, you do act a particular role, that's true. That's a character represented as on stage. Whole world is a stage, and we are enacting a drama, and we have taken for ourselves a character. For example, we don't have to go into all details. Just see, if every one of us, if I ask, who am I? Well, I'll say, I'm Ulhas, I'm a doctor, I'm this. And we also know that these are the roles that we play. And what is there inside which really defines me? And then there is something that defines me, and according to that, I behave in the world as a character. The way of behavior, the way of presenting one's own self in the world. So, character represented as on stage. Freud was very clear about it. There is something, the body is there, the mind is there, and there is supply of energy. And all that makes you a character which would enact a particular role which either the world or you have taken upon yourself. Accordingly, Freud looks at sex in a different manner. As a force to attract, force to unite, and a force to create. So, next, a capacity in which one is acting. We are all aware that in the course of our usual behavior, we all are acting our roles. And here is the point. Can we go to, again, 1.1? That's what I'm talking about. Yes, 1.1. Living soul. Freud was very keen on looking at, number one, person as a living being and a living soul with a lot of energy invested into it. He talked of life rather than rules of mind. And then the physicist within him said, all this has to follow certain rules. That's why he was a determinist. Self-conscious being, this concept of the self and being conscious has always pervaded Freud's personality. So we understood now how Freud understood the term personality, genesis. Now, in present day psychology, we call it development of personality. Freud talked of psychosexual genesis. Genesis, generation, creation, and production. Freud was very, very particular about whatever occurs has, number one, to be created, then it grows, generates, and it produces something. And that's the way he looked at sex: generation, creation, production. Hence, how Freud was a deep thinker. And he would go to the root, the determinist. He would go to the root. Latin, genus, birth, and a kind. You are only one of your kind in the world. You are a human being, all right, but you are the only one of your kind in the world. And the birth. And then the development. So this is the way, if we go to the basics, this is the way Freud looked at sex himself. He thought about it and he gave the further terms. Hence the term Genesis. Genesis is the first book of Bible which tells us about how the world came into being. So, talking of sex, he speaks of how everything came into being and how everything further develops the genesis. Later on, the psyche, which is the point which I want to tell to you. Freud was very keen on using the term psyche. Only in less frequent, with a less frequency, he uses the word mind. Much more so, he uses the word psyche, the soul, spirit, mind. The spirit of life is what he was concerned about. Soul, according to him, mind is one thing, soul is much larger, much deeper, and spirit is what allows us, it gives to us the energy to live, which is what the point which I repeatedly would like to impress upon you. Freud talked of energy dynamics, the spirit, how it moves around, okay, principle of mental and emotional life, and conscious and unconscious. Right from the time he ever gave a name to what he was talking, psychosexual genesis of personality. He gave a title to it. Right at that time, he was keen, he was aware of the conscious and unconscious parts of mind. Then, psyche. In Greek mythology, one of the meanings of the term psyche is butterfly. Greek mythology, personification of the soul depicted as a young woman with butterfly wings, beloved of Eros. Eros is god of love. So ever since Freud started presenting his theory, he was keen on the dichotomy and their union. On one hand, there would be psyche. On the other, there would be Eros. Greek mythology, god of love. Also, it means all that is life positive. That's greatness of Freud. He, to a common man, the word erotic has some different connotation. And sexual and erotic. And here the term sexual means whatever happens between man and a woman. For Freud, Eros was all this and much more. Eros is life in the way it presents itself. Freud looked at Eros as everything which is life positive. Further, sex. Now we come to that first line with which I began my speech. Sex is that which decides, determines, differentiates, and accordingly designates. Very simple. We are doctors. Two gametes meet. The moment sperm meets the ovum, two things occur. A decision, male, female. And it also determines, it doesn't change then. All that happens afterwards is an outcome of this decision. All that happens afterwards is what happens out of this determination. Do we realize that even in our, we behave in the world, we behave as a man, as a woman. Do we realize that there is a decision and a determination behind any simple behavior that we ever do? Sitting on a chair. A man also would sit on a chair, a woman also would sit on a chair. But the way, the body language will be different. And this, the girl has learned ever since beginning. So decision and determination, sex as a decision and a determination. And one would not go against it. One would behave in a determined manner towards it. So it's decision, it's a determination. Differentiates. Now, this is an ovum, this is a sperm. They unite. Clear. The two lives are gone, one life begins. And from there, the differentiation starts. All sexuality, according to Freud, is a process of differentiation. The oral stage, the anal stage, all the stages, Electra, Oedipus, all is how the differentiation occurs to the adulthood. From the latency stage to the genital stage. How differentiation occurs. And it goes according to certain rules. Hence, Freud was a determinist. It has to go according to rules. It's not something which occurs at random. No. So that's the way we looked at it. Sex is that which decides, determines, differentiates, and accordingly designates. As soon as a baby is born, the doctor or the ayah, the nurse would say, "Oh, congratulations, you have got a daughter. Congratulations, you have got a son." Designation. And from there onwards, socialization also occurs that way. Simple things, we learned them in our first book in psychology. A baby girl, a baby, small newborn baby, is treated differently than a male baby. That's because the designation, boy, girl. And then we train that baby to behave according to that designation. And then we become proud. I am a man, I am a woman. And then there are so many things which become shobhatat, which become a manly personality, which look good, appreciated on a female personality, so on and so forth. Okay? So that's the way in designation. And we behave according to that designation. We declare our designation. I'm a man, no doubt. Somebody says I'm a woman, no doubt. Designation. And we are psychiatrists. We also know that there are people who have doubt about this designation. Am I good enough of a man? Am I good enough of a woman? These are the conditions we should treat in our clinic. So the designation is an important 4 Ds. Decision, determination, differentiation, designation. Okay? Chalo. Below all this, is there a theme which underlines these 4 Ds? The theme is union and creation. That's the reason why Freud uses the term eros, psychosexual, and genesis, union and creation. Attraction, love, union, creation. That's the way Freud looks at sex. Further, 4 Ds which are included here are decide, determine, differentiate, and designate. They are 4 important ones. There are other 6 which we'll see at the end of my lecture. Okay, carry on. Point 2, basic human conflicts. Because for Freud, since he was a determinist, he would always say, let me go into the details of what the conflict is. Conflict also has rules. Going through the conflict also has rules, and solving the conflict also has rules. Hence, he was a determinist. So he looked at human life as full of conflict. Basic human conflicts. Man, according to Freud, human nature is in itself of a dualistic type. Conscious, unconscious. Social, personal. Everywhere you go, it's a dualistic. And one always has to solve the dilemma. So basic conflicts are 2. Conscious versus unconscious. And biological animal versus social being. If you carefully look at it, these 4 pillars of how they are the 4 basic pillars of our life. Conscious versus unconscious. Biological versus social. Biological animal versus social being. Freud has gone at length to describe how the biological animal being all of a sudden erupts into the social being on one hand. On the other, how social being trains the biological animal. The social being almost converts the biological animal into a pet. आपल्या घरात आपण कुत्रं बित्रं सांभाळलेलं असतं ना, ते कसं छान वागतं, आपण जसं शिकवतो तसं, आणि शिकवलं तसं वागलं तर आपल्याला छान वाटतं तसं. We behave in the society as if our master is our society, and we behave in a trained manner in such a way that the society would appreciate it. And then we put sub-clauses to it. I would behave in the society as much as I would appreciate, and then I would behave like a man. I would behave like a woman. Now, these differentiations, so these 4 pillars, conscious, unconscious, biological versus social, according to Freud, these are the determinants of our life. And all that ever is manifested out of these 4 points is life. And the expression of life, according to Freud, is called sex. Because sex is full of energy. Freud always talks of energy. Unconscious, full of energy. Conscious, rationed source of energy. That's the way he would go about. So, one would go through these 4 conflicts. With what result? 2.3, results of conflicts, personality develops. That we know. Socialization occurs. No. Acculturation occurs. True. Further, this is where Freud really, there are occasions where Freud is at his best. Further, man accepts about 3. Personality develops, socialization occurs, acculturation occurs. Man accepts it. One has to accept it. And once you accept it, there is some bonus which is given to this pet called human being. That bonus is values are created. And we accept the values and behave according to the accepted values. Result is we get pleasure. Here is Freud, Salam Freud, pleasure principle, pain principle. So pleasure principle, he gets pleasure, and then he realizes that all this training, all this parade which I have been doing all through my life, and from which in fact I got no excuse, I can't get away from that. And if I behave like that, then I will have pleasure. Sukha milel. Su आणि kho is something. Su means good. You feel like having it. That is su. And kho म्हणजे indriyo. All bodily organs. So having done that, the bodily organs they are pleased. Freud looks at sex. Pleasure principle. या प्रकारे केलं असता जीव सुखावतो. This term, the pleasure principle. And all of us, we keep pleasure principle as the foremost guiding principle for our life. Because pleasure principle dominates our life, Freud said sex dominates our life. Clear? Now, point 3 is something which I would like to draw your attention to. Point 3 is also the one which I would request you to please carefully listen to it, because in our textbooks, as we learned, this polymorphous perversity was not taught to us. So please understand this polymorphous perversity. Poly, many, morphous, forms. Perversity is something which we need to learn. Per, accordingly, as per rules. That means according to rules. Per means according. Versity, that's something. For medicos, it's easy to understand. Version. The way it takes a turn. That's version. And especially the gynecologists would know that. There is version that the fetus undergoes. So version, taking a turn, that's version. Perversion, taking a turn according to some rules which one would not know, but there is taking turn. Energy of the body which is diffuse, which is going all over the body. Initially, right there, when it was a unicellular being, multicellular, and then organs develop and so on and so forth, yet there is a distribution of energy all over the body. When the baby is born, baby is full of energy. That's why as soon as we see a baby, we as adults, we become happy. Baby has no words. She doesn't say good morning to us. Just by seeing the baby, we become happy. That's because all over the body, there is energy. There is tej म्हणतो ना आपण tej. The baby has that tej, which makes us happy. So now we are come to polymorphous perversity. So there is a distribution of energy all over the body. So we are happy, pleased to see the baby. Gradually, as the nervous system develops, number one. And number two, Freud is very keen on that, learning. As soon as the baby is born, we feel learning starts then. In fact, learning starts the moment there is a life which comes into being. When we were students, we know that the fetus moves. If there is a discomfort, fetus moves. So we call it the fetal distress. So the fetus does not have words, but there definitely is a position of ease, and being ill at ease, not necessarily disease. That's something which we must realize. That's where Freud is great. Freud spoke of ease, and being ill at ease, disease comes much later. That's the way Freud looked at manifestation of life, which according to Freud is sex. Come on. So then we know that the nerves develop, nervous system develops, and energy distribution becomes localized. It does not go all over the body, it becomes localized. So it takes a U-turn. Instead of going all through the nerves or over the body, it takes a U-turn, goes along the nerve only to the target organ. And the target organ accordingly behaves. It takes a U-turn. Energy distribution takes a U-turn. That is the meaning of the term perversity. And polymorphous. It takes many forms. It goes from a particular organ, then particular organ behaves in a particular manner. Hand behaves in a different manner. Sexual organs behave in a different manner. That's something very common for us to understand. But main point here to realize is the manifestation of energy in itself takes various forms. Speech is one form which manifestation of energy takes. And these various manifestations of energy, according to Freud, was sex, because it occurs only there, nowhere else, and it unites and creates. The energy and a particular organ would unite and create a particular behavior so that it gives to you the gratification, satisfaction. That gratification term, Freud is very keen on understanding. Okay, so that is polymorphous personality. And we have seen then in the polymorphous perversity, the energy from general distribution comes to a specific organ, specific target. From there, sexual instinct. It's there all over the body initially. The scope of the sexual instinct narrows to a specific organ, specific desire, thought, emotion, behavior, attitude, all become specific. From general to specific, the turn that the energy takes, that is polymorphous perversity. That's the way Freud understood sex. Chalo aage. Point 4. Basic points for the meaning of sexuality. Freud was a clinician. So he has taken examples from his clinical experience. This is something, now those say interpretation of dreams, psychology of everyday errors, that we know. But let's see how they formed the base of what Freud spoke as a clinician. Basic points for meaning of sexuality. Number 1, pervert. Here, Freud means pervert in usual common language, common parlance, P-A-R-L-A-N-C-E, common parlance. Because pervert is something, in common language, pervert is an indecent word. Somebody who behaves in a diametrically opposite way, which is not accepted, which causes embarrassment to others, that is a pervert. So Freud in his clinical practice saw many perverts. He would understand their mind, and that's why I have said pervert in its usual sense, pervert behavior. And later on, all the stages, they are initially examples of perversion, and later on, how socialization brings them in the disciplined life or the way we live. So he based his theory on observation of perverse. Some people, the people who behave in a version, taking a U-turn. He took example of those people. Then neurosis, hysteria, hypnosis, and free association. Energy distribution initially is everywhere it goes, and from generalized to specific. Number one, whether it would occur. From general to specific, whether it would occur. And if it occurs, will it stay or will it go away? That is anxiety. Or something where one feels so much about an emotion or something, a possible loss of it disturbs the personality so much that he starts throwing dramatic symptoms, which is hysteria. Hypnosis, remove the conscious inhibitions and allow him to express himself. Procedure by which this is done is hypnosis. Some patients would not be hypnotized, hence free associations. All those things we know. A point which I want to draw home to you is neurosis, hysteria, hypnosis, and free association all have one common factor, and that is there is a stream of life below it, and at each of these four portals, neurosis, hysteria, hypnosis, and free association, at each of these doors, energy comes out in a different manner, which according to Freud is erotic. That's the way Freud relates sex to life. Chalo aage. Interpretation, neurosis, and interpretation of dreams. In interpretation of dreams, Freud gave sexual meaning to many of the images that one would see. This is not the time to go into the details about how Freud gave meaning. We are running short of time. But interpretation of dreams very heavily leans upon childhood and a covert sexuality. And all interpretation of dreams, according to Freud, comes down to the unconscious sexual motives which influence the conscious behavior. Interpretation of dreams. Okay. Now, talking about perverts and neurosis and all this, we said we are not going to talk about the abnormalities. We are talking about the normality. So come down to the point. Return to normality. Allow me a moment to little gulp of water. Return to normality. Psychosexual genesis of personality. 5.1 oral stage. Sucking and biting. Sucking stage and biting stage. Both are done by the organ called mouth. So, what are the functions of mouth? Taking in, holding. Taking in, holding. Taking in and holding, if you combine them, it makes third one, C, sucking. Taking in and holding together make C, sucking. Biting, spitting out, and closing. Putting an end to it, stop it, closing. Now, I would like you to look at these 5 functions of mouth. Note, these behaviors occur in usual adult sex also. See how sex is related even at that stage, oral stage. The infant, so small, total days of life that he has lived on this earth, maybe a few weeks, few months, hardly a year or two, true. But all that we term as sexual behavior in adult life is related to these 4 basic functions of mouth: taking in, holding, sucking, biting, spitting out, and closing. More about closure. There are 4 meanings to the term closing. 1, prevent entry. Now, please realize how they relate directly to adult sexual behavior. 4 meanings to the term closing. Prevent entry. Stop. Go nearer proximity. To cover. To put it away from vision. All these are related to sex. And the examples of this we see in our clinic. Put away from vision. Physically, it happens. There is a young man and a woman who say we are in love with each other, parents don't agree. What they do? They put them apart. True. But putting each other away from vision does not stop thinking about that person, or then doing such behaviors on one's own body as if that person is there. Autoerotic behaviors. That's the way Freud relates oral stage to usual adult behavior. Chalo aage. Freud said, now what he has said, it has got a value. He defined trait, T-R-A-I-T, he defined trait. Freud said, each of these meanings is a prototype of things to come. What's going to happen in future? A person faces various situations. He handles stress. He manages worries. In doing so, he does it in a novel way every time. We feel we are dealing with it in a new way, novel way every time. Do we realize that a pattern of reaction is already set? This is developing a pattern of our personality. A fixed pattern of personality is trait. So pattern of reaction is already set. So the response becomes almost automatic. That is called trait. So Freud defined predictable, automatic sexual behavior or a trait in terms of sex. Please realize this. So, 5.5, prototypes of future traits. These 6 actions of mouth, as we have seen above, are a prototype of future traits. Like example, taking in may develop into acquisitiveness. I'm not going to talk more about it because we have learned it in our theory. So, taking in may develop into acquisitiveness. Holding may be a forerunner of tenacity. Spitting may turn later into rejection. Common clinical terms. But see how Freud relates it to life, and from life, how he relates it to sex. Further, 5.6. Anxiety. This is the greatest contribution of Freud. 5.6. Anxiety and frustration lead to personality development. Frustration leads to personality development is the greatest donation Freud made to psychology. Frustration leads to development because frustration otherwise would lead to anger or it would lead to depression. Freud looked at anxiety and frustration in a positive manner, erotic manner, life positive manner, and said frustration leads to personality development. Example, a baby may not get breast when hungry. This leads to frustration. Now the baby thinks this may occur again. I may not get breast. Possible. This may occur again. This causes anxiety. And then baby resolves it, cries, then becomes quiet, then goes to sleep or something. Or the mother would intervene and give to the baby something else, but not the breast. And the baby learns to come to terms with it. Learning to come to terms with it means development of personality. So resolution of anxiety leads to development of personality. See how Freud relates sex to normal life. Resolution of anxiety. Chalo, aage. 0.6. Next stage, from oral to next one, anal stage. 6.1. For baby, feces and urine have a non-specific but important symbolic significance. It's a sexual significance, but it's a non-specific and important. Retention and expulsion. Even in adult life, that is true. So it may not be exactly defined in adult words because the baby does not have words. But the basic mechanism of thinking puts it in that type, in that pipe of thinking. Okay. See now, 6.2. Initially, their retention and expulsion, feces and urine, their retention and expulsion are not under voluntary control. Yet, both actions offer gratification. This, all of us as parents know it. A small baby does not have control on defecation and urination, but there is a pleasure in doing it that we can see on body movements of the baby. So since they relate to pleasure and growth when they occur in natural manner. Now see this sentence. Initially, their retention and expulsion are not under voluntary control. True. Yet, both actions offer gratification. Understood. Pude. Since they relate to pleasure, retention and expulsion. They relate to pleasure and growth. Every time the baby expels it, one moment has gone, growth occurs. When they occur, but when they occur in natural manner, initially there is no voluntary control and expulsion occurs. The parents do become worried if the expulsion does not occur. Or if the control on expulsion does not occur in a particular age step. So, in a natural manner. Also, there may be pain if anything goes wrong. Mothers tell this. My baby cries. At the time as she passes urine, the baby cries. Doctor, please do something. Now, Freud termed them as sexual, since they relate to life, that is eros. Hence the term erotic. For Freud, the term erotic means all that is life positive. It does not, it has got no, peno-vaginal relationship is a part of it, but wide meaning which Freud gave to the term erotic is all that is life positive is erotic. Further, 6.3, toilet training, voluntary and learned control on retention and expulsion, voluntary control. On one hand, they occur as a step in development physically. Development of the nervous system, development of those organs, muscular, okay. They develop physiologically, one hand. But on the other, they have to be taught and learned, taught by the parents and learned by the baby. That is toilet training. So on the other hand, they have to be taught and they have to be learned. The latter, teaching and learning. The latter signifies compulsory role of socialization in personality. This is an important statement. The latter signifies compulsory role in socialization in personality. That means, for example, sexual development. In fact, it is a compulsion internalized. Do you realize that all socialization is compulsion internalized? So there is retention, there is expulsion at will, at a decision, and this becomes generalized. For all that we live in the life afterwards, we retain and we expel at our decision and we get gratification. This is an important point to note. Freud developed an upwardly growing helical growth. Both actions occur periodically, in sequence, somewhat rhythmically. In either case, if they properly occur, they lead to gratification, hence termed sexual. Now, 6.4. What is the generalized significance of toilet training as adults? In other activities of life, also the trio of retention, expulsion, and gratification occurs in cyclical fashion. Retention, expulsion, and gratification. This is the basic trio for everything that we do in our life. In cyclical fashion, and represent an upwardly moving helix of development. We learn to earn money, we retain it, and then we spend according to our decision. So retention, expulsion, and when we spend it according to our pleasure, we get gratification. Sexual, erotic. Again. 6.5. Socialization as controller. Essential learning. Precursor of proper resolution of further stages. Now, I'm not going to go into all those details because that's a very different term. It would require another lecture. We'll only go through the points. Point 7, phallic stage. 7.1, pleasure of genital manipulation. The baby would do it, not with adult meaning, but pleasure of genital manipulation is there. And then we train it. Do it, don't do it only under proper circumstances, so on and so forth. So, learning from general to exact, non-specific to specific, properly goal-directed behavior. These 3 principles are important in learning. From general to exact, non-specific to specific, and properly goal-directed behavior. This is all learning in one sentence, short. Narrowing of interest onto a particular organ. Maybe sexual, but maybe any other organ also. So, narrowing, the narrow scope, heightened pleasure, greater social restriction. These are the 3 important points which occur. Narrow scope, heightened gratification. When you do it according to the rules of the society, there is a gratification, greater gratification on completion. A step further to maturity and social acceptance. When we grow, we are doing a step further to maturity and social acceptance. That, in brief, is the end result of phallic stage. Now, I'm not going to go into the details of further points, because the point which I want to drive home to you, how Freud applied the term erotic to common behavior and how it is significant, how it is right. That point I have already made, so I am not very keen on going into the details of further points. Point 8, 2 complexes. The Oedipus situation and the Electra complex and their resolution. Oedipus situation, simple. Son fixates himself on the mother. Electra situation, daughter identifies with the mother and pleases the father. And their resolution. All that gradually goes and usual heterosexual behavior sets in. That we learned. Point that I want to drive home to you is, from here onwards, the direct sexual terms could be applied. Earlier, up to anal phallic stage, we have to really understand how Freud understood those terms as being erotic or sexual. Further, Oedipus and Electra and their resolution, okay. Point 9, latency, further. Latency period, 1 step prior to genital stage. Motive, behavior, and satisfaction are now fixed on to particular organs. So, phallic, related to a particular organ. Generalized sexual, no, related to a particular organ, phallic stage. And then in the phallic stage, initially it's all important. Later on, we learn to reduce the importance to a particular area of life. So 1 step prior to genital stage, motive, behavior, and satisfaction now are fixed on to particular organs. Point 10, genital stage. In genital stage, motive is well differentiated. Organ of action is fixed. Male organ, female organ. Organ of action is fixed. Satisfaction is attractive. socially controlled, but it's very attractive. Yet there is quite an agitation. Young people, we do see them in quite an agitated state. We in fact even say, he is an adolescent. ठीक आहे, असं होणारच आता, वयात येतोय. Now, these are the terms that we use. Okay, there is quite an agitation. Its successful resolution leads to normal sexuality, although pitfalls may occur. Pitfalls, when they occur, we see them in our clinic, but that's not my topic today. Now I come to the summary. Point 11, summary. 10 Ds of sexuality. Sex is that first 4. It decides, determines, differentiates, and designates. These we have seen. Next 6, it defines. It defines the way you think about yourself and you present yourself in the society outside. It describes. Somebody, describes a person. It delineates. You are supposed to behave in a particular manner. It draws for you a figure, delineated, linear, नकाशा काढून देते आणि त्याप्रमाणे आपण वागतो. Delineates, designs. Everybody designs the way he behaves. He or she behaves. That's designing your sexuality. Declares. साधं आहे. मुलगा म्हणतो मी आलो. मुलगी म्हणते मी आले. आलो आणि आले. Declare. And with all these 9 points, what happens, the end result is develops. Sexuality develops. Last 11.2. For Freud, life and sex are almost synonymous. 11.3, last sentence, all conclusion of what I have been saying. Purpose of sex is to unite and create. Unite and create. That is the genesis of personality. Hence, the psychosexual genesis of personality, my friends. Thank you. You have been very kind to me, giving to me so much of time. Thank you. Here it is. Shukriya. Thank you very much. Now, I am open for comment from you, suggestion, questions, all feedback that you want to give is welcome. Carry on. Now, back to Madhumita Bahale.
Thank you, Dr. Luktuke, sir, for such an intensive and engrossing basics of Freud. We were really very much engrossed in all that you were teaching us. I now ask the audience to please put forward their questions so that Dr. Jyoti Shetty madam can take them up and we can discuss with the Dr. Luktuke, sir.
Yeah. Dr. Bahali, there are already questions which had come in. So without further ado, I think whatever has come, because we may not be able to take all the questions, we have just about 10 minutes left.
Okay.
So one of the questions is by Aarti Prabhu. At what early age of a human sexual desires are expected to develop? I think that was the question. So
would you repeat it? I did not understand it.
Yeah, Aarti Prabhu asks, at what early age of a human sexual desires are expected to develop?
Oh, that in fact, that is the psychosexual genesis of personality. But clear, this is man, this is woman, this is manly behavior, this is woman behavior. Oral and anal stages pave a way for this behavior, but from the further, the phallic stage, the genital stage, that is where the lines are clearly drawn. Boy behaves like a boy, girl behaves like a girl, and they feel attracted and start behaving. So it is that time onwards, clearly, we don't have to go to Freud for that. Even in our already normal observation, we realize that even 4 or 5 years old children, I'm a boy, you are a girl, they speak these terms. So there is obviously an adult sexual connotation when the girl says, I'm a girl, and all girls come together. You're a boy. तू तुझ्या वेगळ्या ग्रुपमध्ये जा. So these ideas start occurring even from the age of 4 or 5. They become quite clear from age 8, 10 onwards. That means the differentiation occurs from latency onwards. From latency onwards, the differentiation, socially acceptable differentiation occurs. So
Yeah.
that's the answer.
Okay. Dr. Ranjan Bhattacharya had asked Freudian view on genital phase and latent homosexuality in the current perspective.
Repeat.
Dr. Ranjan Bhattacharya asks Freudian view on the genital phase and latent homosexuality in the current perspective. What was his views on latent homosexuality?
Now, it would take a little time to explain all this.
There is another question.
Homosexuality, choice of sexual object. This comes much later. But the roots, as we have seen, can be traced back to the oral stage, can be traced back to the anal stage. If the anal stage is not properly resolved, in adult life, attraction towards the anus may become manifest. Or even in the oral stage, liking a man likes a woman. This, in fact, is a social training. I like my own self. That's one thing. I'm involved in my own self. I like somebody else. Good. Then the socialization. Man is expected to like a woman. Woman is expected to like a man. And that's the main discussion nowadays. If a man says, okay, I like another man. The woman says, I like another woman. And that's the reason why homosexuality is now removed from the list of abnormality, even in law. So roots of isosexual behavior, in fact, go to even the oral stage, anal stage, but much more so about the anal stage. Faults can occur in non-resolution or faulty resolution of the Oedipal or Electra situation. This can happen. Quite commonly, this could happen. So, failure of resolution of either the oral, anal, or the Oedipal situation can result in homosexual choice. Homosexual behavior may or may not occur. There are so many people who, if they are really talking their heart to you, many of them would say, yes, in my own mind, I am attracted towards men, but in society, no, that's not good. So I better restrict myself to my married life with my wife. Now, this is something which we, as clinicians, we see it quite commonly. There is nothing great about it. We know it. We see it in our practice. So that's the way I feel the homosexuality. I doubt whether any age or any stage could be pointed out. All this, the homosexual behavior, whether it could be attributed to one stage only. Hence, the psychosexual genesis. It starts right from early age, but the choice of body with particular sexual organs, that comes much later in life, That comes from latency onwards. That comes from latency stage onwards, because our society does not allow sexual expression, heterosexual behavioral expression in stages earlier to adolescence. That's the answer.
Yeah.
Further.
I think we'll just take one question. It's by
Yes.
Shruti Joshi, and it's basically, since it seems to be relevant about about Freudian the psychology to present day. So then what she's asked is whether the word sex was used by Freud in a generalized term as pleasure. If not, why Freud compared every behavior and disorder from a sexual point of view. Many saints, monks, those who are celibate don't have such issues on sex. And generally speaking, like, I think most young people will ask, what is the relevance of Freud today? So I think that would be subsumed in this question. So maybe a few thoughts on that, and then we can wind up the session.
What's the relevance of Freud today is a
Yes.
question on how you understand Freud. For example, we don't have to go too far. In our own practice, Freud has no relevance now. We only treat the disease in terms of biochemistry, genes, receptors. Freud has no relevance to our psychiatric practice as on today, that about the psychiatrist. So in common man's life, Freud has no relevance. Yes, there are people who laugh at Freud's ideas, and laughing at Freud's ideas is very common. I have worked in the field of sexology also for many years, and it is very common in the field of sexology to call names to Freud.
No, that was the question that was
Wait,
asked.
wait,
That
wait,
Freud.
wait.
Yeah.
So if that is so about the experts, it's no surprise that common man has no relevance at all. Freud has no relevance in common man's life if the way we understand life continues to be in the present manner. Freud has given a very different perspective of understanding life. If we imbibe that perspective, then we'll be able to see sex as a source of energy, not as a line to draw, male and a female. And if that happens, then Freud has a relevance at every stage of life, literally at every stage of life. If we carefully understand, yes, abnormality ही कल्पना आपण आपल्या मनातून आधी काढली पाहिजे. This is one famous sentence. People laugh at me for this sentence. The sentence which I utter is, I don't know whether Freud meets you, how often in your practice. Freud meets me in my practice every day. It depends upon the angle through which we look at life. Not only as clinicians, every person has an angle to look at life. If that angle is a mature one, the development, if he understands those 10 Ds, then he would realize that life is quite full of sex, because idea is union, attraction, production, creation. All that unites, all that loves, all that produces is sex. If you understand that way, Freud has an application in everybody's life at every step, provided the understanding is from that angle. That's enough, I think, for that question. And given the time constraint. Again.
Okay. Yeah, that was the last question, I think, because the others were not really relevant to the talk. So I think those
I'm
were the
thankful
number
to
of
you.
questions.
Thankful to you
Thank
for
you,
the
sir.
patient listening. Thankful to you for very intelligent questions. I hope I have satisfied what the questioner wanted from me as answer. Back
I
to
would like Dr. Kunil Jyoti Prakash to please step in. He's the president of IPS Pune to just now summarize and tell us the whole gist of today's presentation and intense discussion that we have had.
Ma'am, thank you. I don't think Freud and the sex can be summarized in 1 minute, but I'll just take few minutes, 1 or 2 minutes to complete the session. I think we have already overshot the time. I'm indeed thankful to Dr. Luktuke for hosted Aziz start you. Okay. Sorry, I forgot to start my video. Yeah, I'm indeed thankful to Dr. Luktuke sir for such a sexual and stimulating presentation today. And when I heard the topic sex as Freud saw it, I was almost visualizing a peeping Tom. But reflecting, I found he was one of the best peeping Tom who could probably telescope the whole concept of psychiatry and psychodynamics. And that is what we had today in our gist. And throughout the whole session, we heard our Luktuke sir talking about Freud, how he saw various organs in our sexual component, organizing various components of our life, like personality and any other thing, even the unconscious also. So, sir, thank you for such a wonderful sex talk on the first day of 2021, sir. Thanks a lot, sir.
Thank you very much.
Yes.
Thank you, sir.
Yes. Thank you very much, Dr. Luktuke sir. Now the final golden words and a takeaway home message that you would want us all to take along with us.
I think I have spoken that sentence. The purpose of sex is to unite and create genesis of personality and to achieve that full grown tree genesis. So it begins from zero and grows into a fruitful tree. That, I think, is the basic message which Freud ever wanted to give to us. Thank you.
Thank you, Dr. Luktuke sir. Thank you all.
Unite and create.
And thank you all those who have joined us for this first webinar of the IPS Pune and the PPA. With finally saying that one of the Freud's quotes that which will perhaps summarize that no one person will die if there is no sex, but the whole humanity will definitely die. So thank you very much. With this, I would like our secretary, Dr. Bhalchandra Karme and Dr. Sandeep Mahamuni to extend their vote of thanks.
Yeah, thank you, madam. At the outset, I wish all happy, healthy, and prosperous new year. It is really a wonderful academic starting with Pulse of Wisdom, a monthly series by a senior psychiatrist. Dr. Luktuke has opened the series in fantabulous manner. Many thanks to him for accepting our request to deliver the first section as the opening batsman. I also thank Dr. Bahade, Dr. Jyoti Prakash for moderating the session. I thank Dr. Jyoti Shetty and Dr. Dhananjay Astulkar for coordinating the session in a fantastic way. I thank all senior psychiatrists, colleagues, friends, along with psychologists for attending the session in large attendance. We have more than 200 delegates for this live session. I thank Mr. Anurag Srivastava, Mr. Anirban Mitra, Mr. Mahesh Apar, Shruti Shettigar and Rahila Khan and the entire team of Centaur for being academic partner and for arranging things in perfect fashion. There is no have really taken hard work to make this session successful. Thank you once again and Happy New Year to all. Over to Madam.
Yes. Thank you, Bhalchandra. Over to the center team for their closing.
Yes, ma'am. I think I take this opportunity. I think this is a wonderful start of the year, and I thank the IPS Pune branch and PPA for giving us a wonderful opportunity to be a part of this academic extravaganza. I think this is the best way to start new year for me. I'm seeing all my pillars who in front of my own eyes, and I can say that my new year is going to be this year is going to be very good by seeing all of you. And I want to thank Dr. Luktuke for his insightful presentation. And I'm also sure people sitting across have got good amount of learning from this session today. Thank you again on behalf of all of us. And we also want to thank the medical fraternity who are present here. And I'm sure the knowledge gathered today will be very, very useful. And today and tomorrow in your day-to-day practice. And at the end of the day, from Centaur Pharmaceutical family, we will meet you timely and bring you such kind of more programs in future. Do support us the way you have supported us in our journey. And it's a very small gesture that says that you all remember us and we thank you for remembering us. So thank you again. Before closing the session, I want to wish, and on behalf of Centaur, we wish you, each one of you, stay safe and take care of yourself and your loved ones. Happy New Year to all of you. I think I will request the President and the Secretary, IPS and PPA, to give us more opportunity to be a part of this program. Thank you very much, Dr. Asturkar sir, for giving me this opportunity.
Definitely. Thank you.
Thank you.
Thank you.